You have probably been told that cancer prevention is largely about screening, about catching things early, about luck, and about genes you were either born with or not, and there is truth in parts of that, but there is a piece of this conversation that almost never makes it into a 15-minute clinical appointment, and it is the piece that the research has been pointing toward consistently for years. After 50, your body's internal environment changes in a way that directly influences whether cancer can take hold, and that environment is something you have considerably more influence over than most people have ever been told. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what keeps this kind of conversation reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will understand the specific biological process driving cancer risk after 50, the 3 evidence-based tools that address it directly, and exactly what to discuss at your next physician appointment. Let's begin with the distinction that changes everything in this conversation. Most people hear the word inflammation and think of something visible: a swollen knee, a sore throat, redness around a wound. That kind of inflammation is acute inflammation, and it is your immune system doing exactly what it should do. It is temporary, targeted, and resolves when the threat is gone. The inflammation that matters for cancer risk after 50 is something entirely different. It is chronic low-grade inflammation, a persistent, invisible smoldering process with no obvious symptoms, no pain that points to it, no visible swelling. You feel essentially normal while it operates in the background year after year, and the research is unambiguous about what it does over time. A landmark study published in Nature Reviews Cancer found that chronic inflammation is a contributing factor in approximately 25% of all cancers worldwide. A separate major analysis tracking over 100,000 adults found that individuals with elevated inflammatory markers, specifically a protein called C-reactive protein, had significantly higher rates of colorectal, lung, and breast cancer over a 15-year follow-up period. 25% of all cancers connected to a process that produces no obvious symptom and that most standard appointments never measure or address. That gap between what the research shows and what the average clinical conversation covers is exactly why this video exists. Why does chronic inflammation create an environment where cancer can take hold? The mechanism operates through 2 distinct pathways that compound each other. The first is DNA damage. Your cells divide millions of times each day. Most of the time that process is highly accurate, but chronic inflammation generates persistent oxidative stress, meaning your cells are continuously exposed to chemically reactive molecules called free radicals that can damage DNA during replication. When that damage accumulates faster than the body's repair mechanisms can correct it, mutations develop. And accumulated mutations over time are how uncontrolled cell growth begins. The second pathway is immune suppression. Your body maintains a population of immune cells called natural killer cells whose entire function is to patrol tissues, identify abnormal or precancerous cells, and eliminate them before they can establish themselves. Chronic inflammation directly impairs the function of this surveillance system. The natural killer cells become slower and less effective. The window opens for damaged cells to evade detection. Here is what makes this specifically relevant to anyone over 50. After that age, the body undergoes a documented shift toward a more pro-inflammatory baseline state. Researchers call this process inflammaging. The immune system begins producing more inflammatory signaling molecules called cytokines and becomes less efficient at resolving inflammation once it is initiated. Lifestyle factors that were manageable in your 30s, a diet high in processed food, irregular sleep, physical inactivity, begin to have a compounding effect after 50 that they simply did not carry before. The biological rules change, and most people are not told. I had a patient I will call Genevieve. She was 58, came in for a routine review, was in reasonable general health and had no major complaints. When I ran an inflammatory marker panel as part of a broader assessment, her C-reactive protein was consistently elevated over 3 separate measurements. We reviewed her lifestyle in detail. She slept 5 to 6 hours per night consistently, ate a diet heavy in processed and refined foods, and had been largely sedentary for several years following a knee injury. We had a direct conversation about what those numbers meant and what was driving them. She made 3 specific changes over the following 3 months. At her next assessment, her inflammatory markers had dropped by 41%. She described feeling more energetic and clearer than she had in years. Nothing she did required a prescription. Now let me walk you through the 3 evidence-based tools that the research consistently shows to be the most powerful available for reducing chronic inflammation and its associated cancer risk in adults over 50. The first is dietary pattern, the EPIC study, the European Prospective Investigation into Cancer and Nutrition, tracked over 500,000 people across 10 countries for more than a decade. It found that individuals whose diets were rich in colorful vegetables, legumes, whole grains, olive oil, oily fish, and nuts had dramatically lower rates of several cancers compared to those eating a typical diet high in processed foods, refined sugars, and red meat. In some cancer categories, the risk reduction reached 30 to 40%. The mechanism is specific and documented at a molecular level. Extra virgin olive oil contains a compound called oleocanthal that inhibits the same inflammatory enzymes as ibuprofen, except it is delivered through food rather than a pharmaceutical. Dark leafy greens including spinach and kale provide folate and antioxidants that protect DNA integrity during cell division. Fatty fish such as salmon and sardines are rich in omega-3 fatty acids that have been shown to lower circulating levels of key inflammatory molecules, including interleukin-6 and tumor necrosis factor alpha. Berries contain polyphenol including resveratrol, which a study published in Cancer Research found can interfere with multiple stages of cancer development from initiation through to metastasis. These are not marginal findings from small studies, they are replicated findings from large-scale prospective research published in major peer-reviewed journals. The second tool is consistent moderate physical movement, and I want to be precise about what the evidence actually supports here, because this is frequently misunderstood. The recommendation is not intense exercise, it is 30 to 45 minutes of moderate intensity movement every single day, walking briskly, swimming, cycling, anything you can sustain consistently. The reason this matters for cancer prevention is biochemical and specific. When you engage in moderate aerobic activity, your muscles release signaling proteins called myokines that have direct anti-inflammatory effects throughout the body. Exercise also reduces circulating levels of insulin and insulin-like growth factor, both of which, when chronically elevated, create a hormonal environment that favors the proliferation of abnormal cells. A large meta-analysis published in the British Journal of Sports Medicine found that individuals who met recommended physical activity guidelines had a 20 to 30% lower risk of developing colon cancer, a 20 to 30% lower risk of breast cancer, and significantly reduced risk of endometrial and lung cancers compared to inactive individuals, 20 to 30% from walking. The American Cancer Society, in its most recent guidelines, identified physical inactivity as one of the most significant modifiable cancer risk factors, second only to smoking and obesity. And yet it remains one of the most underemphasized recommendations in clinical practice. Before I continue, I need to say something clearly. The dietary and lifestyle changes described in this video are evidence-based, meaningful, and broadly safe for most adults. However, they are complementary to, not a replacement for, your cancer screening schedule, your physician's advice, and your existing treatment. If you are currently managing a diagnosis, do not use the information in this video as a reason to delay or skip recommended screenings. Do not interpret a reduction in inflammatory markers as confirmation that no cancer risk is present, and if you are managing an autoimmune condition or taking anti-inflammatory medication, discuss any significant dietary changes with your physician first, as interactions are possible and individual circumstances vary. The third tool is sleep quality and duration. This is consistently the most underestimated of the three by patients who otherwise understand the importance of diet and movement. During sleep, your body performs the cellular repair work it cannot execute during waking hours. DNA repair enzymes are most active in deep sleep. Your immune system consolidates its surveillance capacity. Your body clears metabolic waste through the glymphatic system, a process that is only fully activated during sleep. A study published in the Journal of the National Cancer Institute found associations between chronically shortened sleep, defined as consistently fewer than 6 hours per night, and increased risk of colorectal and breast cancer. The mechanism connects directly to inflammatory markers. Sleep deprivation elevates circulating cytokines and impairs natural killer cell function, the same immune surveillance system that chronic inflammation already compromises. 6 to 8 hours of quality sleep is not a lifestyle preference, in the context of cancer prevention, it is a physiological requirement. I want to tell you about a second patient I will call Bernard. He was 63, came in initially for an unrelated complaint. But during our conversation mentioned that he had a strong family history of colorectal cancer and had been told by a previous physician that his genetic risk was simply something he would have to live with. His inflammatory markers were elevated, he slept poorly, moved little, and ate a diet almost entirely composed of processed and convenience foods. We focused on all three areas systematically. 3 months later his C-reactive protein had dropped by 38% at his oncology review. 6 months later his physician noted that his inflammatory profile had shifted substantially and remarked that whatever he had been doing was reflected clearly in his blood work. Bernard told me the most important shift was understanding that he was not simply trying to feel better, he was actively changing the internal conditions that had been increasing his risk. That understanding changed his consistency entirely. Here is exactly what to do with what you have just heard. Step 1. At your next physician appointment, ask to have your C-reactive protein level measured. This is a standard blood test that quantifies your current level of systemic inflammation. Most adults over 50 have never had it measured. Ask for the result in specific numbers and ask what your physician considers optimal rather than simply within normal range. Step 2. Ask your physician whether your current dietary pattern is consistent with an anti-inflammatory approach and whether a referral to a registered dietitian with oncology or chronic disease experience would be appropriate for your situation. Step 3. Ask your physician whether 30 to 45 minutes of daily moderate walking is safe for your current cardiovascular and musculoskeletal health, and if there are any specific restrictions you should be aware of before increasing your activity level. Step 4. Discuss your sleep with your physician honestly. If you are consistently sleeping fewer than 6 hours, ask whether this is being factored into your health risk assessment and whether a sleep study or targeted intervention is worth considering. Step 5. Request that your inflammatory markers be rechecked in 3 months after implementing dietary and activity changes, so that you have objective data to evaluate whether your internal environment is responding. One important clarification before we close. The tools discussed in this video are most relevant for cancer prevention and risk reduction in adults. Without a current active cancer diagnosis, if you are currently undergoing cancer treatment, the dietary and exercise recommendations appropriate for you may differ significantly from what is described here, and must be guided by your oncology team. Additionally, these interventions address modifiable risk factors, they do not eliminate genetic risk, and they do not replace the cancer screening schedule recommended for your age group by your physician. Colonoscopy, mammography, PSA testing, and other screenings remain essential and are not made less necessary by an anti-inflammatory lifestyle. The goal here is to address modifiable risk on top of, not instead of, the standard preventive care your physician recommends. After 50, your body's internal environment shifts toward chronic inflammation in ways that directly increase cancer vulnerability, but that environment is not fixed. It responds to what you eat, how you move, and how you sleep, in ways that are measurable, documentable, and meaningful. You have more agency over your cancer risk than you may have been led to believe. If this video gave you something useful, hit the like button right now, leave a comment telling me whether your physician has ever measured your C-reactive protein and what you plan to bring up at your next appointment. And share this with someone over 50 who has been told their cancer risk is simply a matter of genetics and luck. It is not the complete picture. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.